And I'm Madison Blythe, and welcome to our informative poster on Povidone Iodine, the hidden strength in dental care. Dental caries and periodontal disease are among the most common chronic diseases worldwide. In dentistry, it is significantly important to develop primary prevention strategies to improving and maintaining oral health. Povidone iodine, abbreviated as PVPI, is a strong antimicrobial that targets oral pathogens, disrupting pathogenesis.
Credible research, including quantitative data, supports implementing a PVPI protocol as a primary preventative agent against the bacteria contributing to dental caries and periodontal disease. This is an emerging strength in dentistry.
PVPI, an iodophore that was introduced in the 1950s, is emerging in dentistry due to its powerful antimicrobial properties. Molecular iodine is especially effective at targeting and oxidizing oral pathogens. However, its potency can result in toxicity and irritation in the oral cavity. To eliminate these side effects, molecular iodine is combined with polyvinyl prolidone, PVP. While PVP does not possess antibacterial properties on its own, it plays a crucial role in this formulation by mitigating irritation and staining associated with molecular iodine. Additionally, PVP enhances the substantivity of iodine, allowing for a controlled release upon contact with saliva. Salivation activates and heightens the antimicrobial action of PVPI in a diluted solution. This combination not only maximizes the antimicrobial benefits of iodine, but also ensures for a more comfortable patient experience, making PVPI an invaluable asset in oral health care.
In an era of rising antibiotic resistance, PVPI presents as a compelling alternative, maintaining its efficacy without promoting oral resistance. The benefits of PVPI contribute significantly to the prevention of dental caries, the combating of harmful bacteria, and the reduction of inflammation. As a result, PVPI not only betters oral health, but has implications for systemic health, given the link between oral pathogens and systemic disease.
Now let's shift our gears to preventing dental caries versus PVPI. More than 75% of Americans developed a dental carie before the age of 18 years old. Early childhood caries is an epidemic, and the need for prevention is at an all-time high.
PVPI inhibits the enzyme glucosyltransferase, GTF, produced by decay-causing bacteria like Streptococcus mutans. By targeting GTF, PVPI squashes its role in the decay process, providing crucial protection against dental caries. The colonization of S mutants, especially with sweet foods, initiates decay. An antimicrobial that inhibits this colonization can help prevent dental caries. PVPI's effectiveness is further enhanced in acidic conditions, allowing it to ameliorate the acid challenge from eating and drinking.
A peer-reviewed clinical study found research relating the effectiveness of PVPI versus S mutants in 15 children with a median age of 4.2, all suffering from severe early childhood caries. The study was conducted by gathering bacterial samples at baseline, preoperative, postoperative with restorative treatment, 6 months and 12 months. PVPI was applied in 3-month intervals. The bacterial count at 12 months remained drastically low compared to that of the control group. The p-value was less than 0.05, proving its statistical significance. 10% PVPI is therefore recommended for the prevention of future dental caries in those who were affected with ECC.
In a comparative study focusing on ECC in 83 children, participants receiving 10% PVPI exhibited a 12-month disease-free rate of 95% versus the placebo, which was 54%.
Another study conducted on the use of PVPI in addition to topical fluoride showed a statistical significant 45% risk reduction in dental caries versus that of just topical fluoride alone. The prevention is the primary focus of dental hygiene, and a drill-free future is upon us with the inclusion of PVPI in dentistry against dental caries. Now let's turn our attention to periodontal health. The Centers of Disease Control and Prevention states 1 in 2 men and 1 in 3 women over the age of 30 suffer from periodontitis. This highlights the need for effective alternatives to combat periodontal disease. PVPI kills all major periodontopathic bacteria within 15 to 30 seconds in vitro and 5 minutes in the clinical setting.
PVPI has been identified as a cost-effective and practical method for subgingival irrigation. Research conducted on this topic indicates that the adjunctive application with non-surgical periodontal therapy significantly reduces both existing and emerging pathogenic bacteria implicated in the etiology of chronic periodontitis. The Journal of Periodontology conducted a study encompassing 16 adults, each presenting with at least one 6mm periodontal pocket within each quadrant. The participants were allocated to one of 4 groups, and the findings revealed a significant diminishment in the total count of pathogenic bacteria when PVPI irrigated was implemented adjunctively to periodontal therapy. The research concluded that PVPI did not outperform saline on its own, highlighting that the presence of calculus could hinder the effects of subgingival irrigation, emphasizing the need for calculus removal beforehand. This step is crucial for allowing PVPI to effectively clean within the whole periodontal pocket.
Periodontitis is characterized by the effects initiated by pathogenic bacteria and exacerbated by the pro-inflammatory host responses. PVPI has the ability to reduce the pathogenic burden while concurrently attenuating to the host's pro-inflammatory mechanisms, thus presenting a promising therapeutic avenue to limit the destruction to periodontal cells. Specifically, PVPI plays a pivotal role in inhibiting the inflammation and edema, primarily by suppressing the activity of neutrophils and the production of cytokines that are instrumental to the proliferation of tumor necrosis factor. These cytokines and neutrophils are integral components to the body's pro-inflammatory arsenal aimed at combating periodontal disease. However, their chronic activation can lead to destruction rather than a resolution of healing. By inhibiting these pro-inflammatory mediators, PVPI provides a conducive environment for healing.
The choice of PVPI over other antiseptics is further justified by the comparative studies on their effects on periodontal ligament cells, which are crucial for the healing and regeneration of periodontal tissues. A 2021 study highlighted the cytotoxic effects of chlorhexidine on stem cells at a concentration of 0.1 milligrams per milliliter. Given that PDLs are predominantly composed of stem cells, the cytotoxicity of chlorhexidine raises concerns regarding its aptness in periodontal therapy. In contrast, the same study demonstrated that applying PVPI at a concentration of 0.1 milligrams per milliliter enhanced the proliferation of stem cells after 24 hours, indicating a favorable impact on periodontal regeneration.
PVPI not only prevents further damage to periodontal tissues, but also promotes an environment conducive to viability and proliferation of PDL cells to enhance NSPT outcomes and the preservation of periodontal health on a reduced periodontium.
As a powerful antiseptic, PVPI products are cost-effective and tolerated well by patients. There has been no reports of permanent staining, and to date there were no resistant forming bacteria. It is also considered non-toxic to the body cells.
Limitations for using PVPI are little and based upon the need for further research. Iodine is a mineral used by the thyroid gland for hormone production. Reactions to iodine are typically considered sensitivities rather than true allergies. There is little evidence to suggest that iodine acts as an antigen in the body, given its critical role in thyroid function. Ionized substances used in radiographic procedures, substances mixed with iodine, and shellfish, which contain high amounts of iodine, could produce a sensitivity reaction.
Additionally, iodine intake during pregnancy can cross placenta to the embryo, potentially causing negative birth outcomes. Individuals with a hyperthyroidism condition may suffer worsening symptoms due to supplemental iodine, and these symptoms have only been noted in the prolonged use of iodine. But if you're pregnant, breastfeeding, or suffer from a thyroid condition, we just suggest contacting a healthcare provider before use.
As highlighted, PVPI enhances the prevention protocols for both dental caries and periodontitis across numerous studies. The American Dental Association recognizes several procedure codes for the topical application and irrigation of PVPI. Elevate Oral Care markets a product that is the release of PVPI for caries prevention. It's sold in an ampule that simplifies the application and regulates the dose of PVPI. Studies suggest that when topically applied PVPI during NSPT, it improves the outcomes. Now, Brooke Crouch from Elevate states that Povidone is advocated for the use of caries prevention, but she also says, anecdotally, we hear it's being used in periodontal offices.
Dental professionals should consider using PVPI in their practice due to its effectiveness, safety, and core alignment with our core value of preventing oral disease and maintaining oral health. And here's a list of our peer-reviewed references, studies, journals, and articles.
Thank you so much for listening to our presentation about Povidone Iodine, the hidden strength in dental care.
Any questions?
And please scan our QR code if you'd like.
Absolutely.
Yes, Ms. Sewell?
Is this something that patients can use at home?
Yes, of course.
So the
Povidone.
yes,
So-
an irrigation
The
dome.
rinse.
Yeah.
It's like a rinse, it's just a rinse?
So Povidone, the
Or
product
ampules?
by Elevate Oral Care, it's like a fluoride varnish. It's got a little brush and it's a controlled ampule of the PVPI. There's 6 applications in each kit, sold for $16.50 at the office. And you would apply the first ampule with the patient, explain how it's used, and then you send them home with the 5 rest of the ampules. And depending on their caries risk, if they're moderate, they apply the ampule once every other month, and if they're severe caries risk, they apply it once every month. But super simple to do at home.
Okay.
But what if it's for perio?
Oh,
So-
perio?
Yeah.
For the
Yes, sorry.
for the irrigation, that would be applied in office,
Only.
just in office only, because we want to make sure patients aren't overusing the product,
Okay,
because we don't want to have any like sensitivities towards iodine.
okay.
But if the one chart for Streptococcus mutans, those effects are gonna hold out for 12 months.
Oh, 12 months?
Yes.
So
So
I
this-
irrigate and it's
So
good for
our
12 months.
our baseline is up here, and then it stays below for 12 months.
So we irrigate with chlorhexidine after every single scaling and gingivitis treatment, and then looking at your chart.
Yeah, the
sorry.
chlorhexidine chart's pretty shocking
Yeah.
too. How we know that our body tries to help us too much. So those patients who come in with severe periodontitis, stage 3 grade, C, they get the non-surgical periodontal therapy, and then their body still continues to attack them. Therefore, what you just worked really hard at is not actually healing. So kind of like host modulation therapy, if you've ever heard of that, Povidone Iodine does play a role in inhibiting those pro-inflammatory mechanisms.
And then also the big thing is it is regenerating and healing our periodontal tissues. With chlorhexidine, it's pretty much just wiping out everything that's in the pocket, bad cells and good cells, which creates an environment that it's favoring bacteria to come in and cause more damage because there's no good cells there to regenerate fast enough. So with Povidone Iodine, it's only wiping out the bad cells, and after 24 hours, it's gonna start developing those new periodontal tissues.
Did you read anything about like oral surgery? Because like some of the oral surgeons will give a patient chlorhexidine after like an implant or an extraction or anything like that. So did you find anything
Yeah.
out on that?
This article right here, 2020 article of the Journal of International Oral Health, has a whole section about oral surgery, alveolar osteitis as well to prevent dry socket. So I would recommend, if you do scan our QR code, totally linkable and you can get right to it.
But as we said, just with the regeneration, like I think that's why we're promoting PVPI so much, because it's gonna maintain that perio health. So when those patients come back, you're not gonna feel like you're starting over again.
Oh, but you normally do feel like you're starting
Yeah.
over again.
Can you get back? Can you back your
Can it
code?
be used,
Yes.
I have one more question.
Yeah.
Can it be used in conjunction with like Arrestin, or what's, like are there any contraindications there
We
between?
did not see any contraindications, because also it's being used adjunctively with antibiotics when needed. But this is supposed to decrease the overuse of antibiotics, to use before if you're hesitant, or after the antibiotic dose is done, to then use again to help maintain that perio health.
So irrigate at scaling, perio chart, perio maintenance, any areas didn't heal, then arrested.
Yeah. Yeah.
Okay.
And it
And,
takes 5 minutes after the irrigation to completely wipe everything out. So maybe if you just have them sit for 5 minutes, I don't see any reason why you couldn't use it. Use the Arestin after, but we didn't see any contraindications.
And we did see a chart that was like a treatment plan chart, and it did show like, okay, a D43, 42, and then it showed what you would do and how you would use povidone iodine in that treatment plan too as well.
Lovely job, ladies.
Thank you so much, everybody.